Hello, everybody. Um, Welcome. My name is Pablo Sanchez. I'm doing my presentation on the Caritas process. And to begin with, I just thank you for your time for watching this presentation. One important member or person to discuss that's extremely relevant when it comes to the Caritas process is Dr. Jean Watson, who is a pioneer in nursing theory, and her work has shaped nursing as we know it today. She is the founder and director of the Watson Caring Science Institute, that at this point I believe we're all pretty familiar with. The Caritas process includes 10 different points um, that relate to nursing as a science in which we all practice today. The number that I decided to focus on will be number 7, which is balance and learning. Um, Balanced learning really means engaging in transpersonal teaching and learning within context of caring relationship, staying within others' frame of reference, shift toward coaching model for expanded health and wellness. I decided I chose balance and learning because I believe that this principle really resonates with what I do in my nursing practice as a emergency room nurse. I believe it is important because in the emergency room, you come across individuals who will be diagnosed with, a range of things. Um, as you all know, we care for a very diverse population from pediatrics to adults to geriatrics, OBGYN, trauma patients, medical, surgical, behavioral health, literally everything that comes in through the door. So when it comes to teaching, we have to be very careful given that our population it's so diverse. Another factor to consider and keep in mind is the act of caring. And to me, and in my practice, we obviously incorporate caring every single day because caring and the Caritas process, they really do go hand in hand. I believe that caring is a fundamental part of the nursing role, regardless of the field of nursing that you practice. Caring is the essence of nursing. This is a quote from Dr. Jean Watson that I genuinely believe, and I do believe that it is an essential part of nursing. It is certainly an essential part of what I do every single day, despite of the task that I'm partaking in. In emergency medicine, first of all, I have had the privilege of working in the emergency room for the last 7 years. Prior to that, I was working in behavioral health before becoming a nurse. But I believe that the process of balance and learning is so important and it is so unique to our department because, again, when we think about the patient population that comes to the emergency room, we certainly have a very unique department. We see folks from suffering from all sorts of medical problems. We see folks from all diverse backgrounds with different resources. We see it all. So again, the importance of being able to teach these patients in a way that they can understand is a challenge, and it's certainly something that's very important. for nursing practice. So we have to consider the illness, their diagnoses, the population we're working with, and their different learning styles. An example would be language. So something to consider when teaching somebody. You have to keep in mind that folks do have, you meet patients every single day in the emergency room who speak a language other than English. So in my experience, I am fluent in Spanish, so I have the ability to communicate with Spanish-speaking patients, and I am able to explain to them, necessary teaching points. And again, I come across folks who are from across Latin America, Central America, South America, Spain, the Caribbean, and for them it is very important that they have somebody with the language expertise that I do, so that they can communicate in a language that they understand, and they have, they are able to gain an understanding of what's going on with them medically. So I think that is very important. Another example that we have to consider would be the education level of the patient, right? So we're thinking about folks with no college or high school education or below. We have to consider cultural barriers, the patient having lack of resources and opportunities. So when it comes to learning and teaching, in the ER, again, I have encountered folks with limited education, less than they should for their average, and we have to keep in mind that teaching these folks has to be done in a very unique way. As a nurse or as a provider, what you say to them, you have to make sure that you're using terms that they are familiar with. You have to present ideas that they can understand, and concepts they can also understand given their level of education. My last example has to do with age and or the elderly. So really with a focus on the geriatric population, as a nurse, as a healthcare provider, you have to keep in mind that there are constantly advances in medicine. There is new medical jargon. There are new medical procedures that perhaps a person that is older may not be familiar with. So you have to take that into account. You have to do a personal patient assessment, determine what they know, whatever they don't know, and from there adjust your teaching. So again, so they are able to understand the words, the ideas, the concepts that you are teaching them. Here are my references, and I hope that you folks enjoyed the presentation. If you have any questions, feel free to comment, and I'll be sure to get back to you as soon as I can. Thank you for watching, and have a great day.